just within, months of being on OnusOne, we increased our revenue per visit about $20. I am Cindy Hill. I work at Kinetic. I am the acting COO of our company. We definitely attempted to do this by ourselves. We, paper and pen and trying to come up with a model that worked, and it did in the short term. The thing that we were missing in our thought process was, how do we tie the revenue to the performance? How do we actually give credit where credit is due? When we first started the implementation process, the therapists were able to really affect their own paychecks based on the codes that they were billing. So I think when they were able to see the cause and effect, not just through a visit, but was actually happening in the visit with their coding practices, and they could see that they're affecting the revenue that comes in, and they're affecting how much of that they're able to get. And that was really invaluable with the rollout process. It has definitely helped us with recruitment. I think before, when we had our own plan in place, we were struggling to sell that. This has allowed us to not only show them how great it is and what their potential is if they work here. It's more that we can focus a little bit more on how great we are. And in conjunction, they can come to a place that they enjoy working, they can get that job satisfaction and make money at the same time. Since we've implemented OnusOne, I would say that the ownership of the patient caseload has fallen much more onto the physical therapist. Our arrival rate has improved because they understand the difference between letting a patient drop off, not fulfill their plan of care during the week, and trying to get that patient in. So there is a little bit more ownership on their side. They don't necessarily wait for the patient to reschedule. They will reach out themselves. I love to tell anybody who will listen that OnusOne is really an answer to a lot of challenges. You hear practices talking about they can't get notes done timely. I don't have a problem with getting notes done. It used to be a problem. It's not a problem anymore. The other thing certainly is billing for time. People tell me all the time how they can't get their therapist to bill more than 3 codes. I've been there. So, this was an easy way to do that. I can get them to bill for their time now. So a lot of the challenges that we used to have, or that I continue to hear other practices have all been resolved because of OnusOne. Hearing about OnusOne, it was like a weight lifted off of our shoulders because OnusOne did all of the work for us. So rather than having to go in every payroll, calculate how many patients we're seeing, we weren't tying it to revenue. So it was a little more difficult for us to kind of come up with a fair model. And now that we could put in units and tie that to actual revenue collections with OnusOne, it was tremendously easier.